Hello and welcome to Harrogate Special Care Baby Unit, also known as SCBU. We are a level 1 unit and this video is an introduction to our unit. If your baby is admitted to SCBU, it will show you some of the equipment you might come across, how you can get involved with your baby's care and what support is available to you. It is also for parents who have been told that their pregnancy is high risk, for family or friends of those who have had a premature or sick baby, as well as for those who simply want to know about life on a special care baby unit. Babies admitted into neonatal care are here for a variety of reasons. Your baby may have been born premature or may not be very well. The doctors and nurses on the unit are here to provide the best possible care for your baby to help them develop. They may need to be here for a few hours, several days, weeks or months in order for them to get better and grow ready for discharge home. There are also two other types of neonatal units, and these are commonly referred to as neonatal intensive care, or NICU for short, and these are a level 3 unit which provide the most intensive care, as well as local neonatal units, or LNU for short, and these are a level 2 unit which provide high dependency care. It is very important to remember that all units vary slightly across the country, regardless of the level of care they provide. And the level of unit your baby requires will depend on the care they need and the facilities available nearby. You might not know before the birth what level of care your baby will need. However, your baby will be admitted to SCBU, stabilised and assessed as to the level of care they need. Here at Harrogate, we take babies from 32 weeks gestation and above. We are the first unit in the country to be accredited with the baby-friendly gold standard by UNICEF, which we strive to maintain. This means that all nurses and midwives can give all the help, support and advice to successfully breastfeed your baby. For babies that are premature or too sick to breastfeed, we give you the same help, support and advice with expressing, as well as ways to improve your lactation. Mums who are supported to be with their baby have shown to have more success with breastfeeding. At Harrogate, we provide family integrated care, where you as parents can become partners in care, which ensures you are central to your baby's care even when your baby is unwell. As parents, you become more confident and competent at caring for your baby, and this has been shown to improve short and long-term development outcomes. The majority of babies are admitted into our Nursery 1 and assessed in an incubator, which is a heated cot that can also provide oxygen if required. It can be a very stressful and challenging environment for families, with lots of different equipment which make lots of unfamiliar noises, such as alarms and beeps, which can be confusing at first until you understand what these sounds mean. As parents, you may feel like you've been thrown into an unknown world with lots of wires and tubes. But once you get to physically see your baby, we encourage early and regular skin to skin, and this will help you communicate and bond with your baby. In some circumstances, your baby may need to be transferred to another hospital. For example, if they are less than 32 weeks gestation or need specialised treatment, as well as if there are no cots available in Harrogate. If this is the case, your baby will be transferred by ambulance in a special transport incubator by trained doctors and nurses called Embrace. Where possible, you should be able to travel with your baby in the ambulance. However, if this is not possible, you will be able to see your baby before they are transferred, and alternative arrangements will be made available. As well as assessing the needs of your baby, this is the nursery where we educate families about the values of maternal breast milk in preterm and sick babies, and the importance and process of early expressing. We aim to initiate expressing within the first 2 hours of birth where possible, and for breast milk to be the first enteral feed given to your baby. Your midwife will help you start this by showing you how to hand express, and we will give you an expressing log which contains useful information and tips on how to hand express. We also encourage earlier and regular skin to skin with your baby. We also have 2 side rooms, and once babies are stable enough, we transfer them into our Nursery 4. This is the nurturing and growing room and is where we establish good milk supply by encouraging regular expressing and doing regular expressing reviews with you. By doing this, we can discuss and respond to the challenges around lactation and establishing good breastfeeding. You will begin to recognise your baby's feeding cues, and by giving you the support you need, You will gain the knowledge and confidence to successfully continue to breastfeed your baby once discharged home. We also have a kitchen on the unit, which is also where we store the breast pumps. You will be shown where you can make yourselves a hot drink and help yourselves to cereal and toast. We have 2 fridges, one for storing cow's milk and one for storing express breast milk. And there is also a freezer for storing express breast milk as well as donor breast milk when required. Next to the kitchen we have a family room. This is where you can eat your meals, which the hospital provides. There are toys and books available for brothers and sisters to play with and read with parental supervision. This is also a room for you to chat and spend time with your visitors, and you will also find a notice board with lots of useful information to read. We have 2 parents' rooms available for parents to stay in, so you can be near your baby. These are situated across the corridor from the unit. Each room has a double bed, a TV, sink and a phone where you can call the unit or we can contact you. There is a separate shower room comprising a toilet, shower and sink, as well as a separate sitting room with a settee, fridge, tea and coffee making facilities and a microwave. Being on SCBU can have an emotional impact on you. You may experience feelings of shock or denial or be overwhelmed by the situation. But every procedure we do on SCBU has a purpose, and it's okay to ask for help and seek support if you feel the need to. For security reasons, parents and visitors will only be allowed entry onto the unit by a member of staff. There are 2 sets of doors with intercoms to come through.
Hello Sammy, can I come in please?
This is to ensure that staff know who's coming in and out of the unit, and a picture of you will show up on the intercom at the nurse's station. Before entering the unit, you need to use the hand sanitisers provided by the dispensers on the wall next to each set of doors. Once you've entered the unit, you will be asked to wash your hands and forearms thoroughly at the sink in the entrance of the unit. This helps to reduce the risk of infection being brought into the unit. It is really important you do this as premature and sick babies can be more susceptible to catching infections. Once on the unit, we provide coloured lockers on the wall for you to leave your coats, bags and belongings in a safe place. The unit has regulations regarding who can visit and when. This is to make sure it doesn't become overcrowded and to allow your babies the all-important quiet time to rest and sleep. We have open visiting for parents and siblings. However, no other children will be allowed onto the unit. For grandparents, aunts and uncles, visiting is between 12 and 7 p.m. Only 2 people will be allowed at the cot side at any one time, but you can wait in the family room and swap over. If you don't have a partner, you can choose one person to be your support network, but it has to be the same person throughout your baby's stay. You will not be able to visit if you or any of your visitors are feeling unwell. This will help reduce the risk of any of the babies on the unit catching an infection. The nurses work in shifts, coming into work and going home at set times. The day shift begins at 7:30 a.m. until 8 p.m. and the night shift at 7:30 p.m. until 8 a.m. This half-hour handover can be a very busy time. It can be difficult for parents seeing different members of staff caring for their baby, but whilst the staff may vary, the level of care should not.
Staff at Harrogate SCBU just made it, I guess, as easy as it possibly could. You've got access to the ward 24 hours a day, and that just doesn't mean visiting. So for me, I used to go twice a day. I was able to go at 6 in the morning before work and then go sort of early evening and just spend as much time as I could with Francesca. But even when we were at home, we were able just to phone any point and we'd speak to one of the nurses who were always on hand just to give us an update on how she's progressing. And for me, as I said, as much as it's traumatic, it's really been a sort of soft landing. So we were taught everything that you could expect to be learn at NCT, and actually we had that real life, so it was absolutely fantastic. So and the best thing for us was actually meeting some of the nurses that we've stayed in touch with. So all in all, it was a really, really positive experience.
Another absolutely fantastic thing was when they prepare you for home, they invite the mother and the father to sleep over with the baby in the room to teach you how they are during the night, to support you with feeding. And another thing is that they teach you CPR and resuscitation on the baby, which again has been invaluable. We've had to use that once being home. We wouldn't have known what to do if we hadn't have had the experience and the teaching from the fantastic nurses at SCBU.
Everyone has been absolutely amazing. All these staff, nurses and doctors support me, and I was so frightened to death each time I carry my child and then he stopped breathing, dropped floppy. I thought that's it, that's the end of the day. But unfortunately, everyone has just been amazing, support me with Abdullah and his condition and his care, and myself. And then looking after Abdullah, we've been here for 2 months. But yeah, I am so grateful, really grateful. We thank God and we are so happy to have these wonderful staff and these nurses and doctors here